Wanted to talk to you about one of my favorite facial rejuvenation cases. This is a 50-year-old nurse, came to me, just wanted to look a little bit younger, wanted everything to fit well together. And so what I talked to her about is that the face was aging all together on her, and we really shouldn't isolate any of these procedures, but really try to make a harmonious result where one area of the face is matching the other. On her, I recommended that we do a brow lift, which is usually minimally invasive approach in my practice, where we reposition the brow onto a higher position on the forehead. That's going to help offload some of this extra skin from the upper eyelid. She also required an upper eyelid lift or upper blepharoplasty. That's where we remove some skin and oftentimes a little fat here from this area of the eye. She didn't like the bags under her eyes, and this is actually very complicated anatomy where we go in and reduce the fat pockets and then also release this ligament, redrape some of the fat over the cheek, while we also inject fat, transfer the fat from her abdomen or hips into this area to help blend the eyelid and cheek junction. Everybody loses volume around their mouth as they age, and so we use fat transfers to fill in these areas, a little bit into the lips just to help plump them up. And then the number one thing that brought her in were these jowls, the heavy jowls. She did not like this shadow leading to her chin, the fullness underneath her chin, the lines in her neck, or the contour of her face in general. She also didn't like how her cheek was lower on her face than she remembered. So I recommended we do a face and neck lift at the same time as doing the other procedures. And so here she is on the right. She's shown 1 year after surgery. And I think she really settled out to a great result. Her brows are in a higher but natural position. Her upper eyelid skin excess is improved. Her lower eyelids are at about as good of a result, I think, as we could have hoped for on her face. We also raised the mid-face with a high SMAS facelift technique. We were able to move the mid-face upward. Then we filled in the volume deficiencies around her mouth, improved her jawline, the necklines are better, contour looks great, and most importantly is she does not look like she's had surgery. This looks like a very rested, refreshed person, and which is really our goal with every surgery. Downtime on this procedure is 2 weeks out from the grocery store. 3 to 4 weeks, usually you're going to be seeing friends with some swelling over the cheeks that is still persisting at that point. 2 to 3 months, I tell most patients they're ready for their close-up, and if we look at pictures at 6 months and a year later, you're going to see an even softer result as time allows that swelling to completely resolve.